Nursing and Alarm Fatigue by Lena Hall. Imagine entering a hospital floor. The sounds of humming ventilators and the blaring of alarms can easily feel overwhelming. The purpose of the devices is to inform healthcare providers of any critical medical situation, but unfortunately can be hazardous and create alarm fatigue. Nurses may feel overwhelmed by the number of alarms or the variety of alarms that can sound at the same time. Nurses are trying to distinguish whether it can be false alarms or unusual sounds made by multiple devices while caring for their patients, which can cause even more stress and fatigue. This phenomenon can easily result in nurses becoming desensitized to monitor alarms known as alarm fatigue. This project will discuss the importance of implementing effective alarm management and the benefits when utilized effectively. The medical field has advanced throughout the generation. It has created technology that provides healthcare workers with real-time information and continuous physiological monitoring to alert healthcare providers when an issue arises with a patient. Healthcare facilities have utilized advanced technology to help improve patient safety and the quality of the nursing care environment. Assisting monitors with alarms has helped maintain surveillance of patients' conditions and vitals. The development of alarm fatigue has been induced by the abundance of alarms and the potential misinterpretation of false alarms. Alarms can falsely be activated due to technical factors and even human nature. Nurses are at the forefront of patients' care. This makes them liable to experiencing alarm fatigue. Alarm fatigue has also been recognized by both the AACN and the Joint Commission. Between 2009 and 2012, the Joint Commission received 98 alarm-related adverse event reports. 80 of these events were fatal, while 13 were caused permanent loss of function. In this project, the macro focus will be a hospital or facility and how alarm fatigue affects it. Alarm fatigue can cost the facility money. Hospitals are intended to provide a quiet, healing environment, but when alarms are going off, it can disturb the healing process for a patient. If the patient cannot heal effectively, this could result in the patient staying in the hospital longer or returning sooner after discharge. The hospital can be penalized if it discharges a patient and they are readmitted within 30 days of release. There are exceptions, such as chronic diseases. An alarm management strategy can save the hospital or facility hundreds of thousands of healthcare dollars. The micro focus in this project will be the units within the hospital or facility. The focus will be in intensive care units and the critical care units. These two units have an abundance of alarms and monitoring. Within these two units, monitoring alarms is an essential principle in the patient's care due to their health being labeled as critical or intensive. The article Alarm Fatigue and Moral Distress in ICU Nurses in COVID-19 Pandemic utilized a descriptive analytical cross-sectional study between April to May 2021. An online survey was conducted through a social media app called WhatsApp and Personal Contacts. A short description of the study and its goals were sent to participants. The data was measured or collected using the three-part questionnaire consisting of demographic information, a nurse's alarm fatigue questionnaire, and a distress moral scale. The study investigated the alarm fatigue and the moral distress in ICU nurses during the COVID-19 pandemic. Its results show that the mean score of alarm fatigue in ICU nurses was moderate. The study showed that alarm fatigue in nurses trained in ventilators and alarm settings was notably less than in other nurses. According to Turmel, implementing an alarm strategy could save nurses hundreds of hours in the long run, and more time could be focused on direct patient care. The primary intervention that could be put in place to reduce alarm fatigue is alarm management. Different interventions can decrease alarm fatigue. Alarm management can be established through a combination of evidence-based practice interventions, including policies, educational programs, and procedures reducing over-monitoring of patients and customizing alarm parameters. Implementing alarm management has been shown through literature that there has been a decrease in alarm fatigue in nurses in the inpatient setting. Interventions that occur within alarm management include a daily reassessment of the need for the monitoring alarm, or as easy as proper skin preparation before applying adhesive-based monitoring devices. If the adhesive is not correctly staying on the patient, this can result in a false alarm. The devices or alarm systems need to be recalibrated routinely to ensure that they are working effectively and properly. Doing these small interventions could have the potential to improve patient safety and significantly reduce challenges with alarm fatigue. Education on the monitors or alarms is essential, and the management ensuring that nurses are trained effectively on the equipment can make a great deal or change during the patient's care. Bach recognized a breach between knowledge of alarm standards and nurses' translation into practice, discussing that there are three domains within alarm standards: a machine learning, alarm configuration, and alarm designs. Machine learning is explained by using smart alarms that implement specific algorithms to determine if the alarms were alerting nurses of critical information or if it was falsely activated. Alarm configuration is the ability of nurses to alter or adjust the alarm parameters that would help meet patient-specific needs to reduce the number of unnecessary alarms. Lastly, looking into alarm designs, the design would have different alarms for different levels of urgency by standardizing alarm sounds based on the machine's perception of urgency. Nurses must know the domains of alarm systems and apply them to their everyday practice. There was a quality improvement project done in 2021 that utilized educational programs to improve the nursing staff's understanding of cardiac telemetry nuisance alarms that would positively impact alarm fatigue. After the nursing staff completed the educational intervention, there was a statistically notable increase in nursing knowledge about alarm management and a decrease in alarm fatigue. By simply having a better understanding of the machine themselves, it can show improvement in decreasing alarm fatigue. In the article, Nurse Perception of Alarm Fatigue, Compliance with Alarm Management, Allen identified issues with too many alarm settings being set and a misunderstanding of the equipment. Throughout the QI project, data was collected to measure nurse awareness and perception of alarm burden before and after an educational intervention. And continuing in this QI project, the National Clinical Alarm Survey developed by the Healthcare Technology Foundation was utilized to establish the baseline of perception and awareness. After the pre-intervention survey, nurses participated in intense education sessions for 8 weeks. Various things were discussed throughout the training: staff participation in developing education posters with weekly unit-specific alarm data, reading and discussing articles on the negative impact of alarm fatigue, and exploring best practice alarm management strategies, such as alarm customization. Throughout the training, it was shown that several nurses were unaware of utilizing customized alarm settings within the devices, which would play different alarms per different criteria of the patients. The QI project results in overall nurse awareness, knowledge of alarm fatigue, and the compliance with best evidence-based practice changes to reduce alarm fatigue. According to McGonigal and Mustrain, nursing informatics is a unique system that incorporates nursing science, computer science, and information science to manage and communicate data, information, knowledge, and wisdom within nursing practice. A way to measure the outcome of the alarm management system would have to have the EHR department develop reports to be able to quickly identify device alarm protocols and set up a routine of when the devices have been recalibrated. The AACN recommend checking alarm settings at the start of every shift with any change in patient condition or caregiver. This action would also be documented in the EHR department's report. It would give evidence of checking the devices and show that the staff utilizing them are aware of the function and settings, etc. The AACN also recommended customizing alarm parameters for individual patients following unit or hospital policy. Setting the parameters individually would also allow for more effective, better care for each patient. Nursing informatics would help access the success or not of implementing the alarm management, which would be supported by the reports created. Personal experience for this project was brought from a nurse who works in an ICU at Munson Healthcare Grayling Hospital. She discussed that alarm fatigue is real and that sometimes a nurse may not even realize they are experiencing it. The nurse described it as a scary phenomenon that can occur while working long hours and so many false alarms it gets tiring at times. She discussed that there should be more training on the devices and that it would be much more beneficial if the devices were used at their full potential. The ICU nurse spoke about how the rise of COVID-19 made alarm fatigue even worse, expressing that alarms were constantly ringing. At times, it would make it hard to decipher what was important and what was a false alarm, which could be overwhelming. The nurse was asked if she felt that alarm management was put in place to ensure better use of the devices, calibrating, education, and other interventions to make alarm fatigue more aware and better looked into. Would it make a difference? She expressed, yes, most definitely. A form of management to better use the devices. So many times during a shift, they can be a hindrance, and it's alarming to see some other nurses silence them or even shut them off in an autopilot response. It can be scary, and then this could be putting our patients at risk. In conclusion, alarm fatigue is a significant concern in healthcare, which has been recognized by both the AACN and the Joint Commission. Throughout the project, it demonstrated interventions that could be implemented and how it could be measured, demonstrate that the utilization of alarm management would be beneficial and could ensure better patient safety. There needs to be awareness of alarm fatigue, and it should be better understood because this concern could be occurring without nurses even realizing they are experiencing it or have been part of it. These strategies or interventions in alarm management could expand nurses' knowledge and skills. Implementing a system to manage better device alarms could also improve the quality of the patient's care, and more could be monitored effectively. The information provided demonstrates nursing leaders could be implementing strategies and policies to help decrease alarm fatigue. The literature recommends that the undergraduate nursing curriculum prepare new graduates with the resources to manage alarm fatigue. Nurses must take the initiative and take advantage of the information that may not help themselves but prevent or overcome alarm fatigue and assist their coworkers in these areas.